Welcome to this video on telehealth, presented by students from Touro University, April Drosos, Jasmine Manathip, Say Reader, and Abigail Simone. Telehealth is the use of technology to deliver health information and medical care. The four main types include synchronous live video, asynchronous store and forward, remote monitoring, and mobile health via phones and apps. Telehealth is the use of technology and digital information to deliver health information, prevention, monitoring, and medical care. There are four different types of telehealth: synchronous telehealth, asynchronous telehealth, remote monitoring, and mobile health. Synchronous telehealth is delivering health information in real time through a virtual interaction, like either a video or phone call. Asynchronous telehealth is collecting patient data and using it at a later time. An example of that would include collecting patient history or imaging and sending them to a specialist to review at a later time. Remote monitoring uses digital equipment to collect patient data, like blood pressure or glucose, to continuously evaluate a patient. Mobile health is the use of mobile devices and apps to deliver health education, reminders, and tracking. Telehealth promotes health by significantly improving patient outcomes, expanding access to care for various populations, and promoting safety and infection control by reducing in-person visits. Telehealth improves patient outcomes significantly in the management of chronic diseases, such as diabetes, chronic kidney disease, and multiple sclerosis. Remote monitoring and virtual visits improves patient outcomes by increasing patient engagement in their care. It expands access for those who are unable to take time off work, have transportation difficulties, or mobility issues. Also, access to mental health services is increased, as patients could receive counseling and assessments can be done through telehealth. Safety and infection control improves, as telehealth removes the need for patients to receive care in person. Patients need telehealth because it removes barriers like transportation, mobility issues, distance, and chronic illness. It enables regular check-ins with providers, which is essential for managing chronic conditions and reducing hospital visits. Patients need telehealth because it helps them overcome barriers like transportation issues, mobility limitations, and living far from clinics. According to Hardy and colleagues, telehealth ensures patients can stay connected with their healthcare providers, which is especially important for managing chronic diseases like diabetes or heart disease. This reduces delays in care and can help prevent serious complications or hospitalizations. Patients use telehealth via smartphones, tablets, or computers. Methods include video calls, phone calls, and online portals, allowing them to share symptoms and send home-monitored data easily from home. Patients use telehealth by connecting with their doctors through devices like smartphones, tablets, or computers. Common methods include secure video calls, phone calls, and online patient portals, as reported by the CDC. During a telehealth visit, patients can share their symptoms, review medications, and send health data from home. The platforms are designed to be user-friendly, making care accessible from anywhere. A majority of patients rate telehealth quality as equal to or better than in-person care. Technology improves the patient experience by being useful and easy to navigate. Safety considerations require addressing disparities like limited health literacy. Patients often rate telehealth as equal to or better than in-person care, especially for chronic conditions. From a nursing perspective, telehealth helps keep patients engaged and supports timely follow-up. However, safety depends on making sure patients understand the technology. Nurses play a key role in education, assessing health literacy, and closing digital gaps to ensure telehealth is safe and effective for all patients. Nurses play a critical role in telehealth adoption. Those with higher knowledge have more positive attitudes. Nursing education is key, as nurses are often essential for patient onboarding, education, and workflow optimization during implementation. Nurses are critical drivers in the successful implementation and adoption of telehealth through their knowledge, positive attitudes, and readiness. And investing in their education enhances telehealth uptake. The pros of telehealth include expanded access to healthcare services. Telehealth significantly increases access to care, particularly for patients in rural or underserved areas, as well as those who have mobility challenges, transportation barriers, or limited time. Patients no longer need to travel long distances for routine appointments or follow-ups, which helps reduce disparities in healthcare access. Studies show that telehealth can improve access to primary care, specialty services, and mental health care, ensuring more patients receive timely evaluation and treatment. Improved convenience and efficiency. Telehealth offers greater convenience for both patients and providers. Patients save time by avoiding travel and waiting rooms, which can lead to better appointment adherence and reduced absenteeism from work or school. Providers also benefit from more streamlined workflows, as virtual visits can be scheduled efficiently, and follow-ups can be conducted with less disruption to clinic operations. This convenience enhances patient satisfaction and allows healthcare teams to reach more patients effectively. Enhanced chronic disease management. Telehealth is especially useful for managing chronic conditions such as diabetes, hypertension, heart failure, and mental health disorders. Remote monitoring and virtual follow-ups allow clinicians to track patient symptoms and vital signs more frequently, catch potential complications early, and adjust treatment plans promptly. This ongoing engagement promotes better disease control, reduces hospitalizations, and empowers patients to take an active role in managing their health. However, there are cons. Telehealth has limited ability to perform physical assessments. One major limitation of telehealth is the reduced ability to perform hands-on physical examinations. While virtual visits allow providers to observe certain symptoms and ask patients to self-report, some assessments, such as auscultation, palpation, or detailed neurological exams, cannot be fully conducted remotely. This limitation may affect diagnostic accuracy and clinical decision-making, particularly for new or complex conditions. Technology access and digital literacy barriers. Telehealth relies on stable internet connections, devices, and patient comfort with technology. Patients who lack reliable broadband, smartphones, or computers, or who have limited digital literacy, may face difficulty participating in virtual visits. This, digital divide can unintentionally worsen disparities in healthcare access, leaving some populations underserved despite the potential benefits of telehealth. Privacy and data security concerns. Privacy and security are ongoing challenges in telehealth. Patient health information is transmitted through digital platforms, which increases the risk of unauthorized access or data breaches. Ensuring compliance with privacy regulations, like HIPAA, is critical, but even with safeguards, patients and providers may remain concerned about confidentiality. These security issues can affect trust and willingness to use telehealth services.